Hello, my name is Chelsea Jacobs, and I'm a PhD student in Evaluation Statistics and Methodology at the University of Tennessee. Today, I'll be presenting my research titled Health Information Access and the One Health Paradigm, Public Perceptions of Medical Librarians as Knowledge Brokers. The One Health framework emphasizes the interconnectedness of human, animal, and environmental health, addressing complex global challenges such as zoonotic diseases, antimicrobial resistance, and environmental risks, which required not only scientific innovation, but also effective communication and access to reliable health information. Medical librarians are uniquely positioned to support this need. They are trained information professionals who facilitate access to evidence-based healthcare resources. However, despite their expertise, little research has examined how the public perceives medical librarians or understands their role in health communication. So, the purpose of this study was to examine public awareness and perceptions of medical librarians and explore how they may contribute to public health communication within a One Health context. This study used the quantitative cross-sectional survey design. Data was collected from 415 members of the U.S. public using an online survey. The survey assessed awareness of medical librarians, prior use of their services, perceptions of their role in healthcare, beliefs about whether they should disseminate health information, and demographic characteristics such as education and gender. I also conducted descriptive analyses and examined differences across demographic groups. Several important findings emerged. First, awareness of medical librarians varies significantly by education level. Only about half of respondents without a bachelor's degree reported awareness, compared to nearly three-quarters of those with a bachelor's degree or higher. Second, we observed gender differences in behavior. Men were more likely to report consulting a medical librarian for health information than women. However, importantly, there was no significant difference in willingness to consult a medical librarian, suggesting that awareness, not interest, is the primary barrier. Finally, and perhaps most encouraging, respondents expressed generally positive perceptions of medical librarians, specifically regarding their role in providing credible health information. These findings suggest that medical librarians are an underutilized resource in public health communication. Within a One Health context, access to trusted evidence-based information is critical for addressing global challenges that span human, animal, and environmental systems. Medical librarians can serve as knowledge brokers, helping translate complex scientific research into accessible, actionable information for communities. Improving awareness of these professionals could strengthen health literacy, reduce misinformation, and support more informed decision making. This study also builds on a strong foundation of research and evidence-based practice in One Health implementation. Systematic reviews, in particular, are among the most reliable forms of evidence for informing health decisions, and medical librarians play a critical role in conducting them. At the same time, One Health initiatives emphasize the importance of evidence integration, communication, and cross-sector collaboration. Given the positive public perceptions identified in this study, there is clear opportunity to expand the role of medical librarians in systematic reviews and knowledge translation, particularly for complex One Health issues. In conclusion, this research highlights a gap not in trust but in awareness. By increasing visibility and engagement, medical librarians can play a larger role in advancing One Health goals through improved access to reliable evidence-based information. Thank you for your time, and I welcome any questions.